The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We are excited for our episode today. We have Helen Beagley, and she comes to us with expertise in so many different categories. She's a nutritionalist. She is a doula. She has worked with foot zoning and whole body zoning. She will talk to us a little bit about Cognomovement therapy and many other things that we can jump right in. She'll talk to a little bit about conscious conception and infertility. So we are excited to welcome Helen to the show today.
So good to have you, Helen.
Yeah, I'm excited to be here.
Helen works with Cognomovement and Mercier Therapy to help prepare women for pregnancy and birth. With a focus on mental and physical well-being, these modalities are centered in alignment with body and mind. She supports the whole process of conception, pregnancy, and birth as a holistic health coach and doula. So tell us more about cognotherapy and Cognomovement.
Yeah, I actually brought the ball, so I can show you. We have this fun, looks like a soccer ball, and it has colors and shapes. You can pass it around, everybody can see what it is. But it is based in the science. A lot of EMDR is there where we can get to the root causes of trauma and belief systems, patterns that are stuck in the body and nervous system, so we can change really effectively in just a couple sessions. Usually our belief system around, say, fear of birth, that's a really big one, wide spectrum there, dealing with the lovely stories that we inherit and hear from our sisters and our aunts and our moms, but essentially it works through the eyes being an extension of the brain. And we store memories like a library filing system in our brain and nervous system. So at the ball in certain positions, it might trigger a certain feeling in the system, in the body, that is tangible. You can feel it. It might feel like heat or tingling. And it's a sensation we draw attention to as practitioners, allowing the body to make a connection with not only the memory, but the feeling and sensation in the body. So essentially we desensitize through bringing this attention, and we do breath work and some other types of movement. We desensitize the nervous system's charge. So if the nervous system doesn't have a charge for something that is trauma-based, generally you don't hear a whole lot of women talking about their incredible birth story, right? We did not sit in the living room or hear from our moms these incredible stories. We heard the bad stuff. We heard the nasty outcomes and how many hours they were in labor and how excruciating it was, and that's the stuff that we're ingrained with as we, approach that for ourselves. So it's a beautiful thing to use this as a form of remapping around that story.
And do you find that a lot of first-time moms are even coming to you hoping to enter the birth space with positivity and removal of that trauma?
Absolutely. They're not always aware that it's there because it's just a given. So I always started off kind of fishing the nervous system, and we do that through where are these memories and what does this feel like? And, as they approach, we actually approach their due date. We actually kind of create a birth plan. Different than your birth plan in normal terms of, I want so many people in the room and I want to have these drugs if I need it. This birth plan is more inclusive in the way that this is how they want to feel through the process. So we really focus on support. I love, I believe it's Dr. Gabor Mate in his book, The Myth of Normal. Love that book. He goes into great detail around the science of the nervous system and the way we need to feel supported and how essential it is for especially a pregnant woman. If you think about that, she's vulnerable. She's never been so vulnerable. And she's relying on her partner, her family, her whatever support system she has to provide safety, food, her monetary needs. And oftentimes she's working in a culture that is fairly toxic and not even supportive of the fact that she has special needs. So working through kind of fishing for where those beliefs are, oftentimes women don't know they're holding those inherited belief patterns in their nervous system, but it really does come out to the forefront when they are facing, this birth experience that, whoa, I have all this trepidation and these nerves around something I feel like I've really done the work on. I've prepared for this. And it ends up being something that when we've done this work on it, they just come to it in a state of peace and neutrality. So, yeah.
What does bring women to you? You mentioned they may not be aware of the trauma that's there, but what is it that helps them find you?
So mostly word of mouth. I work with a lot of the couples that come to see me are not necessarily facing infertility, but they are just of the mindset they want to get as healthy as they can. And I love that. I love that, because when you're already facing and you've already been dealing with months, years of infertility, again, the nervous system stores that as trauma. I'm less than, I'm not enough, I can't do what I was intended to do. So that can look like, just a whole array of emotions and feelings that are more work than someone coming to me and saying, I want to get as healthy as I can. I've heard that you do this. I heard you're a health coach and you work through the feed and you can read the feed, and all these different modalities kind of blend together in this program that I call my Conscious Conception Program. And that's where I actually support the couple for a year. So they come to me pretty regularly, like once a week, for various modalities. As a massage therapist, I incorporate something called Mercier Therapy, which is for the woman to help optimize the pelvic organs. So one of the things that I like to nerd out about, and clients get tired of me talking about, is the fascia system. And we're hearing more about it now, right? The fascia system. This is a system of connective tissue that intertwines all of our organs and bones and tissue. The cadaver lab, the people who run on those labs used to cut the tissue out. Yes, I'm sorry. We have to visit cadaver labs as massage therapists. Most people don't know. We have to go and do that. So I had to get, not dissecting anything. The look on your face. I was not the dissector, but you're able to view and see inside the body, and this fascia connective tissue is around everything in a way that's just marvelous. And I'm a nerd, self-proclaimed. It's fine. It's totally normal. But this fascia tissue is essentially the way that when it compresses as we age, we tend to get shorter. We tend to breathe more. I know everyone fixes their posture when I do this speech, but we tend to compress, and we actually do. I've always wondered, why do they say that we get shorter when we age? Because we are breathing more shallow, because our posture is changing. We are no longer having space in this pelvic region, breathing through our diaphragm. So important. So we're getting in with Mercier Therapy, and we're creating space. And a lot of women will come to me just wondering if they need it or if they benefit from having it, because they're 1 hour long sessions, about 6 weeks is the protocol. They were developed by Dr. Jennifer Mercier, who was a nurse midwife. And she developed a massage therapist, and she developed this protocol recognizing there was no incredible way that women were getting rehab. Like, we go to PTs and we break a bone and we rehabilitate a muscle when it's weak. Nothing really goes on for the pelvic situation. There's pelvic floor specialists now. They are awesome. But this work is a little bit different in that we're going externally. There's no internal work or like chiropractic adjustments here. We're just working the soft tissue. So it's a deep tissue manipulation, allowing blood and oxygen to come in around the surrounding organs and create flow.
That is so incredible that is part of your work. I recently learned about fascia and the system there. I have been going to a physical therapist to treat some diastasis recti pain. Come to find out, it is fascia that I need to be moving. Like you said, just getting that flow and the oxygen. And for the longest time, I kind of just ignored that area because I was trying not to aggravate the diastasis recti. But in doing that, I just ignored the space that needed to be moved and worked. I had 2 cesarean sections with the horizontal incision, and then my third was a vertical incision. And so I feel like that especially interrupted the fascia system because it was right there on the abdomen.
What are some of the things you're doing in physical therapy that have helped to improve it?
The main thing is cupping massages, and what I've learned with that too is I was cupping too aggressively, so it would kind of trigger some pain scenarios. So I've had to find the balance between treating it and not aggravating it. And then also some visceral movement and massages around the abdomen area foam massagers, and just really just working that area to get it moving.
Yeah, it's so interesting to consider that when we do our own little abdominal check, which everyone has the right to do, go in the 4 quadrants and just see, do I have pain or tightness? Does something feel hard here? We shouldn't have any of that going on in the pelvis. Even postpartum, like your postpartum 2-3 weeks, you shouldn't have any hardness. When you talk about both having the vertical and the horizontal insertions there, you're talking about a pretty big area that's not only, we often think the scar tissue is actually just the suture area where we're suturing that back up and we see a scar. It's actually way like all the area that is exposed when they're taking a baby out, especially an emergency where you're doing the vertical. It's usually what happens with that. You are essentially having oxidation of all, like a layer of a scab almost. But because it's being exposed to the atmosphere, that is actually the scarring that a lot of women experience that's way beyond just the incision.
Yeah, and it started with that incision. My physical therapist asked if I had ever done scar therapy or scar work, and I had never heard of that before. So even just that opened the door to this whole system that I was not aware of, moving and utilizing the healing there.
Yeah, and it's crazy that, like I said, we don't really think about rehabilitating after we have our babies, right? Outside of, tissues healing, coming back together, and hopefully we get our bodies back and stuff like that. That's what we're hoping. Bladder function. I believe the stats there are even 1 out of 3 women will never gain full bladder function. So Mercier Therapy also works on the uterus is actually attached to a membrane around the bladder, and when they do a C-section, they detach that membrane. So we have also the scarring between the bladder and the uterus now, which causes some prolapse and things just to move around the way they weren't, supposed to be. But scar tissue is collagen fibers laying down in a very quick, like the body's saying, this is an emergency, we got to fix this fast. It doesn't have the vascular, the flow from blood that regular tissue has. It's scar tissue. So it's not as vascular, that's already a problem. So we're talking about going in and breaking it down and working through that scar tissue. It takes time. But even after just 1 session, women are like, oh, I feel like I have a tummy lift. It felt amazing in ways that no one has ever worked this area for me.
And so do you recommend this type of therapy for vaginal deliveries and for cesarean deliveries?
Yeah, I'll work with moms, even if they have a regular, totally fine vaginal birth. Just the compression of being pregnant, I say just, but we all know it's not just. The bowling ball. Just going through the 9 months of compressing these tissues, things just change. So I'll work on women before and then postpartum. I love to see them 2 or 3 times, even if they've had a completely normal vaginal birth with no complications. So yeah, C-section though, you definitely, absolutely. There's a really good story on my website from a boxer. She was a professional boxer and she went to have the work done post C-section and just talked about her recovery and how much more resilient she was going forward.
So how do you help patients work through their fears around birth and when they come to you with that trauma? What does that look like?
That's a really good question. Again, we fish for what those fears are. Some people know. Some people come and they're like, I absolutely have such a fear of an episiotomy. I don't want to be cut during labor, or I don't want drugs. I'm going to do this the right, so it's really about coming to, they don't even know why they have those fears. Maybe it was a story that someone told them about drugs had this negative reaction, or everything that I do is to try to empower them, come into what is their support system. Do they feel supported? Do they allow themselves to feel supported? As women, I'm going to refer to toxic culture here, we are very underdiagnosed in terms of mental health issues, especially ADHD and even autoimmune disease. We're the ones that are mostly affected by that. But yeah, coming in and just assessing where the issues are, allowing ourselves to be supported starts right at the base. Oftentimes, I have a good partner and my mom's going to be there, but actually the nervous system allowing themselves to be supported. What does it feel like? A lot of them don't know. So it's a really interesting thing to work through the eyes, work through Cognomovement, and find the area where they can really attach to a feeling of support. Then you allow that to grow bigger, and you, as a practitioner, let that get as big as you want it to be. It's it's something then they have access to and they can refer back to. But yeah, it's definitely different fears for different people, but I generally work on it from the same point of where does the nervous system feel safe. Those fears kind of dissipate and go away when the nervous system has support and safety that it needs.
And are you using the foot zoning during these sessions as well, or is that mainly for, the work after the baby comes?
I love it both ways. Foot zoning is safe right after the baby comes out. If I'm there and I'm able to work on that little baby's feet, I love that because you can just get that little nervous system all settled down. Birth is traumatic for babies, just like it is for mamas. And yeah, they love it. Babies start just getting addicted to it. Their mamas will bring them like every week for a while because GERD is such a big thing. Nervous system again, right? You're dealing with a little sphincter that will stay open too long and they get the nervous system reaction of throwing up. So foot zoning is awesome for that. I like to teach the mamas the little signal on the feet where they can do it themselves and just have tools. I love being someone who can give other people tools so they feel empowered in their own home, in their own space. I feel like that's important.
What are ways to manage and reduce pain and stress when you're a new mom?
Whew, okay. I think we've lost the art of becoming present there. Pain and stress, mostly we mean stress. Stress is just something that even the CDC now is coming out saying 90% of all disease can be rooted in some form of stress management. So really the conscious conception program, whether I'm working with couples to conceive or it's more of a training program. I'm training you so that when you are postpartum, they don't experience that type of stress. They have tools, ways to manage. When I am feeling overwhelmed, I can, resolve this through, I teach breath work, but tools around, how to manage that, just becoming present, unplugging, right? We are all familiar with what it is to be too plugged in and we feel our systems wired and firing with what's next. We're just used to almost instant gratification with ordering things that we need and get mad at Amazon when it's not there by 1 p.m. the same day. I just focus on teaching them how to become present and really experience what they're going through. Not sidestep it or repress it. Feel what they're going through, ask for what they need. It's okay, giving them permission, but that starts, I love when I'm seeing a couple and supporting them before pregnancy because pregnancy catapults you into all these big things. It just puts a big magnifying glass on everything that's not working right. But then we're supposed to carry it through with, this badge of, I'm fine, I got this.
I've recently been reading the book, The Anxious Generation by Jonathan Haidt, and he looks at it from a perspective of our children having a play-based childhood instead of a phone-based childhood. But what I've also realized in reading his statistics and his data, it's affecting adults equally. And when you were talking about that stress that comes from the next notification, I think the data he gave was that the apps are giving us a notification every minute. And so then I was thinking about it like my own children. I have 3 boys who are 6, 4, and 2, and their attention, right? They need me about every 2 minutes, each of them. And so I realized like this is why I feel stressed most of the time is because I'm having an interruption every 30 seconds. If I'm holding a phone or if I'm helping my children, there's so many outside things that are coming at me. To find that inner calm and peace, you do have to unplug and you do have to create an environment so that you're not just living like, okay, what's next and how can I respond? Be there for the online world or responding to your digital devices instead of creating that inner peace that can alleviate stress.
Absolutely, 100% agree. I love the quote from Eckhart Tolle in his book, The Power of Now, where he refers to what problems do we really have right now, like right now. That's another amazing Cogno session because get out of the past, don't worry about the future, in this present moment right now, what is wrong?
And that seems like it needs to be one of the takeaways for our new moms. What is the problem I am facing right now? Because when you have an infant or when you have an infant coupled with toddlers, you are not going to be able to respond to everything all at once.
Change those expectations. Really, it's not that you're lowering them, it's that you're being realistic with what they are. And we have to serve ourselves as moms. We have to put ourselves first, despite, the stigma around that we're selfish or, just, I think that's starting to shift. I think especially women are starting to realize, I don't want to turn out the way that I saw my mom. When she became an empty nester, or, however that evolved, she didn't know herself. She didn't see what her needs were. She didn't have passion. She didn't have pursuits. She didn't know herself. She didn't take that time. It was not encouraged back then, right? I feel like we are facing this awareness now that what we can actually offer our children is developing ourselves and having them see that we are strong and resilient, but also sometimes we cry, and that's okay. And sometimes we feel broken and just like we're doing the worst job in the world. But yeah, I think becoming present is an art that personally I'm really trying to unplug a little. If I'm trying to be productive, my phone's sitting there, beep, 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 beep. I'm just like, no, I'm setting that in a different room, in a different space, and I have half an hour to finish this task. I don't know if that answered your question.
That's a great reminder to be present and to just focus on the moment and to be there. What would be a tip that you would have if your nervous system is stressed out, or how to know if your nervous system is stressed out?
That's a really good question. Often clients will say, well, because I speak about the vagus nerve a lot, the longest nerve in the body goes from the base of the head to the abdomen. So it is in charge of our autonomic functions, heart rate, how much we sweat, how fast food moves through our digestive tract. People always assume I'm going to be a mean nutritionist when they come to see me and I'm going to take all their yummy foods away. And I'm like, we don't start there. I don't start with food. We start with the breath. We start with reminding your body about deep diaphragmatic breathing. And they're shocked and they're like, well, that's not enough. And I'm breathing all the time. And I'm like, well, you're a shallow breather. 99% of us are shallow breathers. We don't take time to deep breathe. And this whole diaphragm is a muscle. And it's right tucked into our pancreas and our stomach and our liver and our gallbladder. It's all there. So we're actually doing this incredible service for our digestive system when we are deep breathing, as well as the fact that we are accessing the lower lobes, which have most of the alveoli of the pleura of our lungs, where we have that oxygen converting factor. So we're oxygenating like 600 times more by deep breathing through our diaphragm. 600 times.
And do you ever notice how if you even just say the word like deep breathing,
Everyone's like,
everybody stops and everybody takes a breath and realizes they haven't been breathing for a while, because that's a conscious type of breath instead of just like you were saying, kind of like shallow breathing or...
Yeah, it's very normal when we're in that flight or fight state to be chest breathers and respond to stress quickly and adapt quickly. It's great for an emergency, bad for longevity and resilience, and really bad for our mental health.
So what can be some of our homework when it comes to deep breathing?
Oh, that's good. I don't know. Maybe use the technology. I know that there's some apps out there, and I hate to put it on an app, but I have a Cogno Mini that I have my clients do where I map in what it is to deep breathe. But honestly, if it's a priority and you value your health, you're going to just think about it more from this conversation. Just having awareness around these are the benefits and this is the why. I always try to give my clients this is the why, because if you give them enough of the why, the positive why, not the fearful one, we all have those going on enough. The positive why, I get this from breathing, and do it in the car. It's hard to maintain good posture, but posture and alignment, deep breathing, those things are free and we can choose to do them most of the time. They're accessible.
And I think it builds over time. You get momentum in doing it, or you remember more often. I noticed when I had the physical therapy, it became known to me that I was clenching my stomach muscles so much. And now that I know that, I am aware of it and breathe more deeply into the diaphragm.
Yes, awareness. But yeah, it affects absolutely every system of the body. So rest and digest, or flight or fight. And we can shift from the flight or fight in 3 deep breaths into that parasympathetic state. So that's a pretty powerful, free thing that I think everyone can access. And a lot of people don't know how to do the diaphragmatic breathing. It's just belly breath. You shouldn't see your chest rising. Put your hand on your belly, and it is a muscle. If you are not used to doing it, it's hard to do, and you can't really talk while you're doing it. And exhale all the way out. Like, it's not just the inhale, it's the exhaling all the way out. This is driving. A lot of my clients come, and they will be not able to even let me rotate their foot when I'm doing a foot zone, and they're holding their foot half up off the, the table when I'm putting a towel under, and I'm like, you're okay. Just take a deep breath into your leg and let your leg relax and get heavy. And they're like, breathe into my leg. But they make that connection with their body and their mind that, oh, I'm holding up my leg. I didn't even know I was doing that. And if I can go a little deeper with them and they're open to it, I explain that that's a sign they are in a stress state or a flight or fight state. And they've probably been in that state for years, to be fair. A lot of people don't know, well, I don't feel stressed, but that stress manifests in someone. I think it was your question that I didn't even answer, but I will now, about how do you know that you have poor vagus nerve tone or that you're in a stress state. A person will startle easily. Someone will come up behind you and just be like when you're, that kind of a thing. We're in a constant state of impending doom. Something bad is about to happen all the time. We might talk about it, verbalize it. Our sleep, we'll be asleep, but we won't feel rested when we get up. We eat healthy food, but we don't feel any better with our gut. Those are all signs that we have poor vagus nerve tone.
And it's all coming from stress. It's all coming from shallow breathing. Like you said, these things that are free, they're easy to implement. I want to talk a little bit more about the nutrition. Okay. So you were saying that you go into the deep breathing. When we're preparing for pregnancy, and especially postpartum as well, tell us kind of some of the basics of nutrition that we need to remember.
Basics are fiber, fat, and protein in every meal. You got to get enough protein in there. Hydration, not drinking with meals, just some real quick things. Most people are like, I can't drink with my meal. No, you're diluting your hydrochloric acid, which is one of the best ways you can break down food in the stomach. Chew. Please chew. Chew more. If you think you're chewing enough, chew more. Give your digestive system a little bit of a break. It doesn't need to do all the work.
So when do we have our water if it's not with the meal?
Before
the meal?
20 to 30 minutes after is fine, and that's also when I recommend if there are supplements that need to be had that need to be taken with food, 20 minutes after is fine, but give yourself give your system a break where you can digest and keep that stomach acid as concentrated as it can be. Does that make sense?
Yeah. Yeah, so fat, fiber, and
protein.
Okay. Yeah.
Yep, every meal.
So I noticed too that I hold stress in my muscles. My muscles are often tight, and I had a massage once, and she was like, I was talking to your body, and I said, why are you holding on to this? And she said that she heard it's what I've always known. And so it's really retraining our bodies to let go of this stress and to find a better way. I love that word holistic that we use, looking at all parts of the body. How does trauma manifest in the physical form?
I can't wait to answer this question. I love that story and that prelude to this, because there is something I learned in massage school that kind of blew my brain around why. Like, there's a little bit of this woo-woo stigma around, oh, you hold emotions in your body. It's not woo-woo for me, but it was at a certain time I wasn't open to it. And so I understand when clients come and I say something to the nature they're holding emotions in their body, they're like, come on, what does that mean? Tell me why. Explain that. So I was able to put it together in the cadaver lab again. I'm sorry I'm going there, but they were talking about something called Golgi tendons, and they're the little ends on each muscle of your body, and they're a little brain that communicates back to the nervous system that tells how long or short the muscle should be. That's huge. Now understand whiplash. So whiplash, you have all your larger muscles in the neck just, you've just whipped it out, and the nervous system says that was absolutely frightening. That was dangerous. So your brain is very good at threat assessment, not very good at helping us make, good, decisions if it's not flowing out of a trauma state. But that was trauma. The body takes that as trauma, physical, mental, emotional. It was frightening. It wasn't safe. So the body will lock down. The Golgi tendons will tell the brain, that was really traumatizing. Let's shorten all these muscles so we can't whip out like that. So we lose range of motion, and we can barely, and this will go on for years. And I can tell when a client comes to me, and I'll tell they either can't relax their neck or they don't allow their head to get heavy. It's no fault of their own. It's just the nervous system's pattern of saying, this is the best resourceful way we came up with the solution to keep you safe. So let's keep these muscles short. But as you work through the trauma, maybe it's awareness, maybe it's massage therapist telling you, you hold a lot of stuff here and it's all you've ever known. We can resort to, well, why do I believe that? Why do I feel like I need to hold this tension here and start doing awareness and breath work around that area, just softening that tissue and giving yourself permission to shift and change. That can be very powerful.
And what about the use of massage when it comes to inducing labor? Not like you're going to be there the day they have their baby, but in preparing for a baby to arrive.
So because of the blood flow, like a woman, I think it's 15 times the blood flow normally by the time she's ready to deliver, and also the hormones that soften the tissues. For the woman, massage is not something that is considered something that is extremely safe ever to be done outside of a nurturing and kind of very soft type environment. I would much prefer foot zoning or reflexology to massage, because the body just takes that up as signaling the systems to work at their best. Cranial sacral can also be an awesome modality for pregnant women to experience preparation for birth.
You'll hear a lot of people say, oh, I'm going to go do my acupressure or my acupuncture massage as they're within the few weeks few weeks of labor, or their 40-week deadline. And I'm just very curious, is that something that we should be seeking after? Should we avoid it? Should it be part of our consistent care during pregnancy, or do we hold off?
I think massage is awesome for past first trimester. And massage, any of those things are incredible for the woman feeling nurtured and supported and helping with blood flow. She already has a lot of blood flow, but someone who knows what they're doing. It is kind of a myth that you can induce labor through these means, and I get women still coming to me. I had a sister who came to me a while ago. She was like 5 days from her due date, and you know how it feels. We're all uncomfortable. We're like, if this can happen sooner than later, that would be better, so I could, feel like a person again. But I totally get it. But she was like, yeah, I'm ready, and she wanted me to foot zone her, because there are certain moves that work fantastic, by the way, when you're dealing with a miscarriage situation. I've had some incredible outcomes for women where they have been able to avoid a D&C by getting a foot zone. I've actually, that's incredible for there. But for where the body was ready to pass something off, and there were some emotional or nervous system, kind of, it was bound up, and the foot zone kind of gave permission and allowed, and they're coming in and choosing to say, would you assist me in allowing me to pass this baby? That's a completely different thing than a woman coming in saying, I'm uncomfortable and everything's fine. Everything's completely fine and this baby's just here, but I'd really like to, if I could just jumpstart this labor right now, that would be awesome. The body's like, why? Why? Everything's good. So I have never been able to help a woman go into labor through foot zoning, though we have tried. But yeah, it has been an interesting thing to consider. What she says back when she wants to, have this baby, she's all ready to jumpstart this thing, and the conversation goes down like this. So are you ready? Are you feeling ready? And she's like, no, I've got to clean the nursery, and I've still got to do shopping. And I'm like, oh, but you're here so that we can get things going. I think your body says not yet.
The connection between your mind and your body, right? Like asking for labor to come, but not actually being ready for that labor. And there are points, I think, that you can emotionally release in a way that then signals to your body, I am ready. Yes. I have completed all of my tasks, and then just relaxing and waiting patiently until baby is ready.
Exactly. And it's actually, I think, the baby's adrenal gland that signals the hormone process. So that's a beautiful thing if you respect that timing. I feel like that's another reason why a lot of women are turning towards the empowering experience of home birth, because there's a lot more patients there generally. The stats around hospital births, babies are born from 9 to 5, mostly Monday through Friday. I wonder why that is.
And usually around the shift change.
Let's get that baby born.
My oldest was born, I was a teacher, and I finished up my last week of school. We were almost ready for summer, and that's when my water broke the next morning. So just so funny to hear about the timing. Yeah. You mentioned earlier a birth plan, and not in the traditional sense, but could you go into more details of a birth plan?
Actually help through Cognomovement. We come and we have kind of like prenatals, especially if I'm going to be this more of my support system as a doula, where I go in and just, I think, educate on what their choices are. And some of this happens in the pregnancy as they see me. If they do the conscious conception, if they just work with me in the doula capacity, then I don't have as much time to go over that. So it really just depends. But yeah, it looks like me going over with the couple, with both of them generally, and talking about their choices, what they want, the people they want in the room, the people they don't want in the room. A lot of people don't want to offend anybody, right? They don't want to hurt anybody's feelings. I have found that just educating them in the fact of what a doula does and what she doesn't do, they don't know what those boundaries are. Respecting what their choices are. If they're pro-epidural, if they're not, your job is to maintain support. You're not there to catch the baby. So we work through any remaining fears that there are there and creating what would you like your first sign of labor to be like? Mm-hmm. We get into it. And they don't really know. First-time moms are like, well, I don't know. What do I want it to be? So, do you want the traditional, I want my water to break? And we work on mapping this into the nervous system. And that's really something else because a lot of stuff comes up around apprehension about, well, maybe I'm not ready. Maybe, I don't want to inconvenience anybody. When do I call you? Oh, you call. Just kind of that kind of stuff. You call and you get the support that you need. And
do you have any recommendations for that first sign of labor? Would you say it's just like a mild contraction? Or are you saying that you don't try to help them? I had one baby where my water broke prematurely, and that was my C-section. But my other boys, the water, was intact until I started pushing, essentially.
I just kind of have like a little pamphlet that I give them where they read over what the first signs of labor, is it a mucus showing? Is it consistent contractions? Is a little bit of water leaking? Is it back pain? And just tuning into some of those things and how would they like to kind of interact with their own bodies during that phase. Is it like, oh, goody, I'm in labor? Or is it like a neutral sense of this is progressing exactly as it needs to, and I feel very confident and energetic, and I'm willing to take a nap if I need to and allow this process to be. It might be a long time. So no, I don't try to influence it in terms of the outcome, but rather create a neutral space for the woman to feel supported and calm.
And I love the word progression. When it comes to labor, that feels like a word that could be your mantra.
Yeah, and also your trigger. You're not progressing. But yeah, when it's in a positive sense, for sure, progression is just the hardest work you'll ever do. That was my midwife's line to me. And she was the hardest work you'll ever do, and I love that. That was helpful.
We have some Mom Squad secrets that we do every week, and I wanted to share one this week from Sandy, and she said, there are physical, hormonal, and emotional changes that take time and energy to process when you bring home a new baby. Throw out the ants, automatic negative thoughts, and swap them with kind words, positive thoughts, and loving moments of self-care. These small gestures will strengthen your love for yourself, increase your love for your motherhood, and help from burnout in parenting.
Love that. That's
Helen,
awesome.
Is there anything else that you want to share with us today?
Yeah, I did want to touch on one thing. When we talk about the system that I help clients create, not just in terms of conception or pregnancy, but I actually work with clients just in nutrition and autoimmune disease, but there is a system that I feel like is worth mentioning. It was kind of introduced to me at a wellness conference over 2 years ago. It's called the AOScan, and it is an app. And it's something where I actually teach clients to, it takes feedback from your cells and from your voice in a way that you can actually see. I know, it's kind of woo-woo. You're like, how does this work? Are we in Star Trek age? And there's just some science there that you are getting this non-invasive testing done that is telling you what supplements your body is an energetic match for. It also provides a scan called the inner voice, and it allows us to speak into it, and it will tell us what emotions are high or low based on the voice analysis. And it can also tell us in biometrics what supplements we might need, or what calcium or parasites or different biomarkers that might be out of balance. So that is a system that I teach most of my clients to use that becomes something they can do independent of me. And I love that, again, giving tools where they're capable of doing something themselves. So it's crazy that we have that kind of technology, and we have access to people supporting each other with information that's for free mostly. And I love that.
That's fascinating. Will people be able to learn more from you on your website, or how can they get a hold of you?
Yeah, my website is Whole Body and Soul, SOLE because of feet. And yeah, you can schedule a free discovery call with me there, or, set up something more. I've got some good information on there.
Helen, thank you so much for being a guest on our podcast. It has been a privilege today.
It was my pleasure. Thank you.
Thank you. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.